Have you ever pondered the real effectiveness of masks? A question that has sparked countless debates, fueled controversies, and left many in a state of confusion. Today, we delve into the heart of this issue, unearthing the contradictions in the Centers for Disease Control and Prevention's stance on mask effectiveness. In an intriguing twist, an investigation by journalist Paul D. Thacker unveils that the CDC's guidance on mask effectiveness contradicts the findings of its own scientists. Astoundingly, the CDC's own studies found no significant difference in the ability of N95 respirators and surgical masks to halt the spread of respiratory viruses, a conclusion that aligns with numerous other peer-reviewed studies. Yet in the public arena, the CDC asserted that N95 respirators are more effective, a statement that leaves us questioning why the discrepancy, why the contradiction between public advice and internal research. Adding to the intrigue, the CDC's guidance on mask effectiveness has remained untouched since 2007. A systematic review and meta-analysis conducted by experts in 2023 echoed the CDC's internal findings. They too found no discernible difference in effectiveness between N95 respirators and surgical masks. Moreover, they reported numerous symptoms among N95 mask users. Despite these findings, a recent update from the CDC suggests that its own scientists were mistaken, but it doesn't end there. Earlier in the pandemic, the CDC began advocating for masks, contradicting a study published in its own journal that found no substantial effect of masks in stopping the transmission of respiratory viruses. In a candid admission, the CDC acknowledged that there isn't much evidence supporting the superiority of N95 respirators over masks in stopping viruses. This admission, coupled with study results, confirms the pre-COVID-19 scientific consensus on the ineffectiveness of masks in halting the spread of viruses. It appears that the CDC's shift in stance on mask effectiveness might be influenced by factors beyond the realm of science, possibly political. A thought-provoking revelation indeed. So, what have we learned today? The CDC's public guidance on mask effectiveness contradicts its own scientists' studies. There's no significant difference between the effectiveness of N95 respirators and surgical masks. The CDC's guidance hasn't been updated since 2007, and yet they suggest their own scientists are wrong. The agency has also contradicted its own findings in the early stages of the pandemic. And lastly, the CDC's change in stance might be politically influenced, not scientifically driven. In the face of these contradictions, one can't help but question the effectiveness of masks. A question that remains open, awaiting clear, evidence-based answers.